and welcome to week 34 of my Healthy Happy Pregnancy video series. My name is Amber from LoveFit and She, and in week 34 I wanted to talk to you today about pelvic pain. This is something that is sadly very common. About 50% of women will get some form of pelvic pain during their pregnancy, although thankfully far fewer than 50% continue to have pain in the postpartum period. So what I wanted to talk to you today about pelvic pain is, firstly, what is it? Secondly, what causes it? Thirdly, how can you try to prevent it? And then finally, what to do in terms of treatment if you do suffer from it. Okay, so firstly, pelvic pain is pretty much what it says on the tin. It's any pain that you experience around the pelvis. So there are two main types that you'll hear people talk about. Symphysis pubis dysfunction, lovely mouthful there, which sometimes also gets labelled as pelvic girdle pain, and also sacroiliac joint pain. So your symphysis pubis is at the front, right, actually you probably can't see, but right down at the base of the pelvis, right at the front there, and your sacroiliac joints are here at the back of the pelvis. So typically sacroiliac joints are much more stable. The symphysis pubis far less so. So it's really common for people to feel pain right at the front there. Some people describe it as a kind of clicking feeling, but more often than not what people talk about is a feeling like you need to almost hold yourself together. It just feels like the joints are floating around. So yeah, any kind of discomfort in the pelvis is pelvic pain, and as I say, at least 50% of women will experience it during their pregnancy. So what causes it? Well, pretty much like any kind of pain and problem in the body, there's no one set answer. It can be due to laxity of the joints, whether that's from the type of exercise you do or don't do. It could be down to hormones that are coursing through your body. It can also, in some cases, be down to a lack of core activation. So if you just don't have that strength in your core, then especially the symphysis pubis, that is subjected to a lot of vertical force, because where all the muscle attachments are to the symphysis pubis, you've got your adductors, which are the muscles on your inner thigh, pulling down on the pelvis at the front, but then all the abdominal muscles at the front are usually what's kind of supporting from the top, and as long as they're in balance, your symphysis pubis is fine. Now, as we've discussed in previous videos, your abdominal wall is massively put on stretch during pregnancy, so there's a lot of extra force from the adductors, and particularly for people who have very hypertonic, so very strong, overworked adductors, there's going to be a huge imbalance, and those people are typically runners, horse riders, but both of those categories of people tend to have very tight adductors. So if that's the case, it's not surprising if you're a runner, and certainly if you've continued to run in your pregnancy or continue to ride horses, which most people don't do too long because of the fall risk. But yeah, you're very likely to experience this symphysis pubis dysfunction. Other reasons can be previous injuries, and that can be from difficult deliveries in the past or just something completely unrelated. So there are lots of reasons people can get pelvic pain. So then the question, how best to try and prevent it? I've spoken a lot about this recently in the videos, if you've been following, but as with pretty much everything, you'll be starting to get this kind of global picture now. It's all about balance in the body. So the reason you'll get pain is because there's an imbalance or a dysfunction somewhere with the muscles, and that's creating extra tension on these joints, making them move out. And of course, yes, you're working with the fact that all these different hormones, and especially relaxin and progesterone, are softening everything up ready for birth. So much more likely in the later stages of pregnancy. At 34 weeks, I've definitely just in the last day or two started to notice what I would describe as niggles, but niggles nonetheless, just in around my sacroiliac joint. There's just a bit of kind of floaty feeling going on there. But the best way to avoid this is to try and keep balance throughout your pregnancy. So what I mean is, you don't only want to focus on strength, but you also don't want to just focus on really becoming flexible and hanging in lots of positions all the time and opening everything up all the time. You do need this balance between the two, the right amount of tension. So, for example, if you are somebody who likes to do a lot of strength work, which I always have been, and pre-pregnancy, you know, lift quite a lot of heavy weights and really enjoy my strength work. If you only keep working on that during your pregnancy, then you're very likely to get very, very strong and have no flexibility at all. And even with the force of all these hormones on your body, it's still going to be imbalanced. And actually, particularly if you have very, very strong abs, actually that can really make that pressure quite tense in your core, and that can actually lead to incontinence in itself. So sometimes if you're actually, you know, you get an overloaded pelvic floor from having too much strength, if that makes sense. So, you know, it is important to, as we've spoken before, make sure there's relaxation as well. On the contrary, and people often don't think about this, and this is true to the general population, not just to pregnant women, but on the contrary, you can be too flexible as well. So if you think, oh, I'm pregnant now, I better not do any kind of strength training, that's far too much for my body, I should just go and do loads of pregnancy yoga. And don't for 1 minute think I'm knocking yoga at all. I'm not. I've been doing it throughout my pregnancy. I really like yoga, and it's perfect as the balance to your strength work. But if you just do it and you think you shouldn't be doing anything else, then just sitting in lots of wide open positions, you know, they have their place and they're definitely useful, and certainly in much later pregnancy. But if you're just hanging in positions all the time, you are going to decrease the stability. So you actually need to add some bulk and add some stability and strength work. Okay, so trying to keep a program throughout your pregnancy, and hopefully my previous videos have kind of helped with that, but keeping that balance of looking at working the postural muscles, and certainly throughout the second trimester, as long as you're feeling good, really focusing on particularly kind of upper back, glutes. All of these things are going to help stabilize the pregnancy, working on your pelvic floor exercises, as well as doing lots of lovely mobility, adding in some yoga and some gentle oxygenating exercise. That's the best way to prevent it. As I say, your pregnancy program will change as the weeks go on. And for me, now I'm in the last month of pregnancy nearly, you know, I'm changing that, and I'll talk more about that next week. So yeah, keep that balance, keep a varied program, and at the first sign of any issues, address it. That's the key. So other than when you're in very late pregnancy, if you do start to notice any pain, go and see a physio, you know, refer out. Pain should always be addressed. Pain is not good. It might be common in the same way that incontinence is common. It doesn't make it normal. It doesn't make it right. You shouldn't just ignore it and think, oh, well, I'm pregnant, so, you know, I should be suffering. If you are unfortunate enough to start feeling any pain, then treatment. Okay, so firstly, as I've just said, go and see somebody, a chiropractor, an osteo, a physio, whoever, you know, if you've got contacts you're comfortable with, use them. Obviously make sure that they do understand the pregnant body. And if you're very late pregnancy, you know, sort of 35, 36 weeks and beyond, actually, you know, the pelvis should have some asymmetry. And again, I'll be talking about that in the next couple of videos. So actually you don't kind of want yourself adjusted as such, but park that for now. If you're anywhere before that sort of 35-week mark and you're starting to suffer with pains, do get it looked at. And then find the exercise that is right for you. Exercise will help, but some things are not going to help. So obviously everybody talks about swimming during pregnancy, and swimming can be great. It encourages the baby into a good position. It's completely weightless. So again, in late pregnancy, it's lovely for just going and relaxing and not feeling the weight of your baby. But you want to be swimming on your front to get the baby so that the spine comes down towards the front. So breaststroke and front crawl. But if you've got very sore symphysis pubis, then the act of breaststroke and taking the legs apart is incredibly painful. So you want to avoid that. So you could swim and do front crawl, but you probably want to avoid any lunging, deep squatting, actually even just getting on and off a nice comfy recumbent exercise bike is painful because of taking the legs apart. And as will getting in and out of a car be painful. So avoid the things that are making it sore. And try to address it. So if you feel that you're very open, address by strengthening, particularly looking at some of the glute exercises we've done in the past. If you're feeling very tight and tense, see a pregnancy massage therapist, or see a different kind of therapist, as I've already mentioned, and get it addressed, and do some yoga and some more kind of, static release postures, and that should help. Okay, so that's kind of pelvic pain in a nutshell. It's a pretty big field, but hopefully that's given you a little bit of advice. And as always, do drop me a line if you have any questions about it. And I hope you're not suffering too badly, but fingers crossed this will help you avoid it. Okay, thanks a lot. Bye-bye.